So if you could start by telling us how old you are, how tall you are, and how much do you weigh?
19 years old, I'm about 5'10", and I want to say I'm about 195 pounds.
If you're a guy considering gynecomastia surgery, then watch this video where we speak to a 19-year-old patient of ours who's 1 week status post gynecomastia removal surgery. He's going to talk about what it was like living with gynecomastia, how the surgery went, and what the recovery has been like. My name is Dr. Kennedy Hersi with Two Palms Medical Center. We're a men's cosmetic surgery practice that focuses on removing gynecomastia in men. If you've been struggling with gynecomastia, then watch this video. Let's get into it. Well, good morning. We're doing a case of bilateral gynecomastia removal today for our patient. He's had this issue with fullness in his lower chest since at least middle school, elementary school. And you could see he's not obese. This is typically a genetic and hormonal problem. And the problem that gynecomastia poses is that it's a gland of solid tissue. So even if you were to take medications to try to shrink it, it's very unlikely that a mass of tissue the size of like a small chicken cutlet is going to evaporate completely. So it really does become a surgical problem. The good news is that once they're removed, his lower chest is going to be completely flat. And the beauty of this is that problem is going to be solved 100% right away. Our threshold for success though is a little bit higher. We want him to be able to be at the beach, at a pool party, shirtless and confident. And the way we're going to accomplish that is by doing the surgery in such a way where nobody would know that he had surgery. And the way we do that is by concealing the scars. We'll make the scars on the inferior aspect of the areola, and the other scar will be in his armpit. So he's received the preoperative medications. We've seen his blood work and it looks good. So the next step in this case is we're just going to mark him up, and then we're going to move to the operating room. So going back, leading up to the surgery, were you nervous about it? How did you feel about it?
Really nervous, man. It was, I won't lie to you, man. I didn't even wanted to do it the day of the surgery. I felt like, nah, I'm not doing this shit, man. I don't want to do it no more. But I was like, okay, no, but I got to do it. And it was like both of my brains split, like it split in half, and argue with each other if I should say like a reschedule or something. But it's because I get really nervous about surgery and all that stuff because I feel like something was going to go bad or something. It'll be one of those like case studies. But after my parents were like, yeah, let's go, come on, man, what are you waiting for? I was like, yeah, let's go. So, and I'm still glad I did though. I'm glad I didn't say anything stupid like let's reschedule or anything like that.
Yeah, I didn't realize you were that nervous about it.
I always get nervous with some sort of surgery. Dental work, I get nervous about because I feel like they're gonna mess it up somehow, but it has been good.
Do you remember the first poke of the numbing medicine?
Not really, man. I'm not gonna lie. I think that's a good thing. I think that's what really calmed me down the most. That and also the pills I had to take there. But I think I calmed down the most after I barely felt any prick going on in the area, and then I realized. And after that, I started dozing off.
Yeah. Well, I will say on the table, like you did jump, so you don't remember that.
No, shoot. Did I jump? Because I don't remember that at all.
A little bit. So what the sedative that we give, it's called lorazepam. It's a stronger version of Xanax. If you take a higher dose, it causes some amnesia. So that's why I always inquire, like, how much of the day do people really remember? And in your case, you don't remember that much of it.
Yeah, I'm saying how much I could recollect. So I don't know if I'm saying anything that's like true right now. All I know, probably was damn like happiest person here or something.
Yeah.
But
so you don't really recall the initial poke of the anesthesia, which is good. I did do some lipo around the gland to liquefy the tissue and then suction it out. Do you remember hearing like a hissing in your ear from the vaser or anything?
I think I still some speculation of like something like that, but
yeah, that's the kind of the sound the vaser makes.
Yeah, I think I was very spotty in my memories right now for that whole operation. I was awake for half of it, I think, but other than that, memories are spotty, like flashes and all that.
And when we got started with the dissection, do you remember feeling any pulling, tugging, or cutting on your chest?
Now that one I think I do remember. I think it was no pain at all. It was just like I felt my skin like moving a bit, but overall, not much.
We're gonna mark out our operative plan. So we mark the midline sternum, and our access point is from the 3, 6, and 9 o'clock position. And then if he pivots a little bit and raises his right arm, we're gonna make our access point in the armpit hair to conceal it. And then it's a straight shot to the 9 o'clock position. And then the lateral aspect of his pec border. And then now, if you could relax his arm, we're gonna feel for the mass itself. So typically it terminates at the bottom where we call the inframammary crease. So I'm gonna make the dotted line. This is gonna be the inferior margin of where we put the anesthesia. So everything within the dotted line is what's gonna be numb. And if at any point during the procedure he starts feeling tugging or pulling, we encourage him to tell us so that we can add more numbing medicine. So as I feel, we anticipate that the right side is going to be bigger, so we're going to weigh them out and we're going to see how true that is. But as I palpate, you could feel the firm glandular mass, and if you could flex your chest and relax and flex. So it's sitting on top of his muscles. So even if he were to, become extremely muscular, it kind of exacerbates the problem because it's going to push out the gland even more and contribute to the appearance he doesn't want. So it's unfortunate just that exercise can be a little bit counterproductive for guys that are, dealing with gyno. And that is our operative area. And that is the operative plan. The surgery went well, and then you went home with the drains. What do you remember from the time leaving the office to going home, to being at home that day?
From the moment I got out of the operating room, from the moment I was driving back home, I don't remember after that at all. No memories of driving back home or anything, or skipping the whole day. I don't remember that day at all. Like, from the moment I left, I don't remember.
And again, that medication causes amnesia, so if you don't remember something, that's not surprising. We actually did give you a bigger dose, because you requested it the day of.
Yeah, because I was so nervous about it, man, so.
No, which is fine. It's safe. We're not giving you any kind of dangerous dose, but the more you give, the less you remember and the more sleepy you are. You slept for parts of the case, but you were awake for a good amount of it. I guess you just don't remember, which is to be expected with that medication. So you don't remember getting home. You don't remember the rest of the day at home. The following day, you came back to the office. I removed the drain. Do you remember what that experience was like?
Super uncomfortable, man. That's the thing I was gonna tell you right now. It was super, just sitting down there where you pull it in, man. That's what I definitely remember, man. The slight burning sensation that came out, and just the feeling of the drain coming out through the hole. There we go. The hole. There.
A lot of times when the drain is pulled, patients will describe it as a burning feeling. Feels ugly. Some people don't feel it at all, but in your case, it felt pretty ugly.
Yeah.
And it's been 1 week since the surgery. What do you think so far?
So far, it's been great, honestly, man. I mean, so far, I feel a lot better about it, man. I already noticed a major difference. I thought it's gonna be like a gradual thing. It's gonna be like big, and it's gonna gradually. No, but it's immediately, and I do like that. I do like that.
And do you feel like you're going to be more willing to wear tighter shirts, not wear the compression shirt?
Oh yeah, for sure, for sure. I mean, obviously I still got to lose some regular body fat and all that, but that's just going to the gym and dieting and all that. But other than that, I think I will start wearing regular shirts and all that.
A lot of guys have this problem. You're not alone. And anyone who's watching this video probably has gyno and is probably considering surgery. Having gone through the experience yourself, is there any words that you'd give to someone in the position you were in before surgery?
Their position, honestly, get as early as possible, man. So just get rid of this and enjoy your teenage years or 20s, 30s, or whatever without this stuff, because it's annoying. That's for damn sure.
And when did you first notice there might be a problem?
Because I noticed it since elementary, like 4th or 5th grade.
And has it been getting worse over the years?
I want to say it has. I want to say it stayed roughly the same since elementary, going on to middle school, gotten worse, and then since high school, kind of slightly worse, and up until now.
And did it impact your clothing choices?
Oh yeah, since the beginning of middle school, I had to start wearing compression shirts and loose-fitting clothing since I didn't want anybody noticing it. It always got super awkward when we had to go like to pool parties or anything like that.
How has the recovery been over the past week?
I mean, so far it's been good. I think that's all I gotta say right there. It's been good recovery, hardly any issues at all. And so far, I mean, I had like a little issue right here, but it seems to be all fine now, and it seems to be all good.
You're talking about the crease, or?
Yeah, the crease, I had me concerned for a bit, but since you told me it was just like a regular crease, it was just the nipple. So far, it's been all good.
So his right areola is pretty much flawless. His left areola has a little bit of a crease in it. I'm going to put it on screen so you could see it. This is pretty common. I do my best to try to avoid any irregularities to the areola, but you know, it's a known issue. I do anticipate it's going to get better with time. 1 week post-op, things have been relatively smooth. So congratulations to our wonderful patient. He's only 19 years old. He has the rest of his young adult life ahead of him without gyno. So congratulations, and really good for you for getting the surgery done early and not living with it for too long a time.
Yeah, definitely.
And that's it.
All right.